Good afternoon, and welcome to Side by Side with the Division of Mental Health, Developmental Disabilities, and Substance Use Services. Before we get started, here are a few reminders about the webinar technology. Please make sure you're using a computer or smartphone connected to the internet, the audio function is on, and the volume is turned up. Please be sure your microphone is muted for the duration of the call. Questions can be submitted anytime during the presentation using the Q&A feature located on your control panel. American Sign Language interpreters and closed captioning options are available for today's event. The American Sign Language interpreters for today are Danette Steelman-Bridges and Susan King-Lanier. For closed captioning options, select the closed caption feature located on your dashboard. To adjust your video layout and screen view, select the View feature located in the top right-hand corner of your screen and choose the view that works best for you. Today's agenda topics include introductions and mental health, substance use, intellectual and developmental disabilities, and traumatic brain injury, system announcements, and updates. Our focus today is reducing stigma and increasing access to care. At this time, I'd like to turn it over to Kelly Crosbie, Director of the Division of Mental Health, Developmental Disabilities, and Substance Use Services.
Hello, everyone. Thank you so much, Dina. This is Kelly Crosbie, and I'm the director here at the Division of Mental Health, Developmental Disabilities, and Substance Use Services. Very excited to be with you today. We're really excited about today's topics. And we have some great speakers, some who are on our team here at the division, and some wonderful community partners, Philip and Billy, and I'm really excited that they could be with us today. So for those of you that don't know me, I've been in the field for about 30 years already, and I love every second of it. I am a licensed clinical social worker, and I'm a person with lived experience. So just to describe what I look like, I am a middle-aged white woman who has long, straight, reddish, grayish hair, and I have big, dark glasses. All right, next slide. I'm going to go a little bit quickly through announcements, even though there's a lot of them, because we have such amazing guest speakers, and I really want to make sure we focus on the meat of today. So the first thing we'll do is do our awareness celebrations. You know, every month there's a lot of things happening with awareness, and we actually try to tie our hot topics to what's happening with that awareness month and to lift up some of our programs that are supporting that area. So this month's awareness celebration is actually Overdose Awareness Week, which will take place this month, and International Overdose Awareness Day. So we put some important facts on this slide that we want you to know about, as well as some links, because there's actually a toolkit, and you can use this on social media or to do Zoom backgrounds or to do something to personalize your signature, to do LinkedIn posts, just to get the message out. Overdoses are going down in North Carolina, which is exciting. Overdose Awareness Week is a time to really celebrate people in recovery and all of our community work to reduce overdoses. And all of that work is really making an impact. We are down almost 30% from 2023 in the number of overdose deaths here in North Carolina. Today, we're going to talk about some really important things that impact that. We're going to talk about stigma. We're going to talk about access to medications for opioid use disorders, because that's the gold standard of treatment, medications, as well as other supportive therapies and things like peer supports. And we're also going to talk about naloxone and our goal of getting as much naloxone in really key places in the community as we can, because we want to save lives. Last year, we still over had 3,000 overdose deaths, and that's too many. That's 3,000 too many, y'all. It is the #1 cause of death around people who are unhoused. And also 1 in 4 of the people who die by overdose also have a significant mental health issue. So again, all really important things to think about and things that we need to continue to work on, helping people have stable housing and also making sure that individuals with mental health and substance use needs have those needs being met in a competent way. All right, next slide. We are going to talk about some really important highlights from our programs this week. And Brianna is going to take us to the next slide. And I want to shout out Brianna for a second. Brianna is responsible for doing our slide decks every month, and she does a phenomenal job. So I want to thank her for that. And she's sharing slides today. So you'll notice something that Brianna does on the slides, and I want to point it out to you on this slide. Look at the bottom left. You'll see a little icon of an ambulance, and it says strengthen the crisis system. So we're trying to remind folks that we have a strategic plan for the state. And remember, our strategic plan guides our goals, our visions, our measures of success, and it really is where we spend our time, energy, attention, and money. So you'll see the little icons on slides because we're always thinking of all of our work and how it is supporting our strategic initiatives and our state vision for a really wonderful public mental health substance use IDD and TBI system. So look for those icons, and that will tell you what goal in the strategic plan that this work is associated with. So the first thing I want to remind folks is you can order, as always, spread the word, please. At the beginning of every school year, we give out lots of 988 materials, so posters, and I always call them tchotchkes, but I forget what they're called, like the lanyards and the magnets and the squishy balls, all of those paraphernalia that you can pass out and schools can pass out and signs they can hang, stickers they can pass out. We've already had 140 schools reach out. I think we'll set a new record this year. Every year we set a new record because folks are getting the word out about 988. So please order these free materials. We are very happy to send them to you. The slides have a hot link with the form for your school or your community organization, that's fine too, or your after school program, or your Boys and Girls Club, or your YMCA, or your Awana Club, or whatever it is. Please go ahead and fill out the form and we're happy to send you materials. Next slide. Our very own Anna Staley, who's on the call today. Stanley is our State Opioid Treatment Authority. It's a really big title. But she's in charge of, she's got a really big responsibility. She and Pamela and others on the team really support a lot of our outpatient treatment work and our medications for opioid treatment, our MAT work. And so Anna is featured on a podcast. It's a wonderful podcast we've done in partnership with the Governor's Institute. Please give it a listen. But we just wanted to announce that today, and you'll be seeing Anna Stanley later in as one of today's presenters, and you've seen her before. Next slide. Really quick Inclusion Connects update. Remember, Inclusion Connects is our initiative to support people with intellectual and developmental disabilities, and our goals are to help people get services in the community, integrated employment, competitive integrated employment, to support the direct support workforce, and also to support more integrated housing and housing options for people with intellectual and developmental disabilities. We publish a lot of data every quarter. If you go to the Inclusion Connects website, you'll see the innovations dashboard. Surprise, surprise, we'll be publishing a new version of that. But we have this quarter's Inclusion Connects report. It has lots of good data. It'll tell you how many folks are on the wait list and how many of those folks are getting services, how many folks are getting in reach, how many people are transitioning to the community or transitioning to competitive integrated employment. So there's lots of good information on that that's keeping track of all of our work in the IDD space. So please, there's the hot link. Take a look at that quarterly report. Next slide. We just did an announcement last week, and I sent out a LinkedIn post, or I posted a LinkedIn post today about our new partnership with Talkspace. Talkspace is a virtual therapy platform, and we're partnering with them specifically for teens who are impacted by the justice system. So this might be a teen themselves who is a victim, or a teen who is somewhere in the juvenile justice process, perhaps waiting to go to family court. And oftentimes those youth are often victims themselves. The service is available to any child impacted by the justice system, period. And we're giving out this information to court counselors, court officials, our juvenile justice workers, DSS, folks in youth detention centers. We just want everyone to know that this resource is available. Why? Because a lot of kids who are involved in the juvenile justice system have anxiety, have depression, have history of trauma, sometimes have been victims of trauma. That's why they're involved in the justice system. So we understand that these kids need as much emotional support as possible. Sometimes it's hard to find community-based treatment. And so Talkspace is a way for us to get them virtual treatment and quickly. It's a free option that is available to them. We'll be seeing how this works, how kids are using it, if they're using it, and we will hear from their families, from them most importantly, but also folks like family court and court counselors to understand if this Talkspace is working for folks, is if it's helpful to kids. So we hope so, but we'll be keeping track of that. But we're really excited about this partnership. It is statewide, free for all kids impacted by the justice system. Next slide, please. We have a new request for applications out. This is part of us building a stronger workforce. This is for agencies that hire community health workers. We want those community health workers to also be trained in mental health supports. So we know community health workers are out about doing phenomenal health-related work here in North Carolina, help connecting people to services, building relationships in communities. And we want to make sure that they have some mental health knowledge and skills as well, and are able to support people receive much needed mental health services. So that's what this is about, training, equipping community health worker organizations. This is our partnership with UNC Greensboro. You'll click on the hot link here, and there is the application for the funding. It's the Strong Mind, Strong Communities model. Next slide. We have a big announcement to make today. A few months ago, we issued an RFA to award funding to 2 programs who would support youth with opioid use issues. Today, we're happy to announce that the Kellen Foundation in Greensboro, and the Heights program in Cullowhee, I'm sure I'm saying that wrong, so please write in and tell me how to say that better, are helping us to expand services for youth in North Carolina. We know there is not enough. And the whole goal, the overarching goal that we're talking about in today's side-by-side is how to increase access to good evidence-based care for everyone, for youth, for adults, for older adults, whoever. We want to make sure there's access everywhere, rural, urban. And we know that kids are greatly underserved in the substance use treatment system. So you'll see here on this slide a list of the different things we are funding at these 2 organizations. Again, our goal is to make sure we have more accessible substance use treatment for youth here in North Carolina. Next slide. Just a reminder, we continue to support our wonderful neighbors and friends and colleagues who have been impacted in Western North Carolina by Helene. We are still very much in Helene recovery. You'll see probably every week the wonderful team, Dina, who did the announcements today. She puts together a wonderful hot topic. Marla works on those. She also works on my LinkedIn posts. I'm going to give them shout outs. They help us lift up the work of Hope for NC. So I want to thank my team who works on the Hope for NC program. And most of all, I want to thank VIA Partners, Trillium, and their crisis clinicians. So with the Hope for NC program, they were able to hire on-the-ground crisis clinicians who go to community events all of the time. And so we like to lift up in hot topics. And in this slide too, the most recent community event and how they are supporting people at those events. So they're there for emotional support, wellness, crisis counseling, and referral to services. So really proud of the work that they're doing. We get an update every single week on the wonderful work that our partners are doing out in Western North Carolina. So thank you. And this one in particular, we are highlighting the Hope for NC team at VIA. So thank you to the VIA team. Next slide. A few community events, and you'll see on the community events, these are events that we get to go into the community. Sometimes we fund them, sometimes they're just incredible partners. But again, you will see that linkage to our system goals. So the first thing I want to talk about that's really aligned with our topic today is me and the team. You see the awesome team there, Anna, Pam, Sarah, Dee Dee. We got to go down and meet the wonderful team at Christian Recovery Centers in Charlotte. They were trying to teach me how to say that. I think I said it correctly, I think. But Josh and the team can call me out if I'm getting that wrong. So Christian Recovery Centers is a very unique program. And so it was a real pleasure to spend time with them and understand their treatment model. There was a partnership of a substance Use Comprehensive Treatment Program in partnership with a residential center, which does peer-run, faith-based work. So this is a really unique program that uses a clinical setting and medications during early days of treatment while someone is in the residential program. And then folks continue in the residential peer-led faith-based program. So it's a really unique and interesting model here in North Carolina. We want to understand it. We want to understand all the ways that recovery is working for folks. And so we look forward to learning more about their model and to partnering with them. So that was a great visit. Next slide. We also had a wonderful ribbon cutting in Concord. Pyramid Healthcare. You've probably heard the name Pyramid Healthcare. October Road, the oldies like me will know October Road. Pyramid Healthcare is their name. This is exciting, y'all. This is a new residential treatment center smack dab in the middle of the state. It is completely supporting folks with public insurance, so folks with Medicaid and folks without insurance. It is a residential treatment facility. They offer clinical treatment, peer support services, detox, induction, every type of medication and therapy. It's a beautiful facility. You'll see the picture there in the ribbon cutting with the county manager. It's always phenomenal. Law enforcement was there, just such support from the community. It was very wonderful and exciting. Want to just shout out Pyramid Healthcare for helping us increase access to a much needed level of care here in North Carolina, a place where people can go right here in the state, lots of beds, get detox, get medication, stay a while for treatment, and then be referred to community care. So it's a really wonderful model. We're excited about this access. Next slide. I got to go to Holy Angels. If you've never been there, it's truly a miraculous and beautiful place. I got to go with Tina Barrett and Ginger Yarborough. You see them there in the picture, as well as the wonderful executive staff and some of the wonderful consumers there at Holy Angels. So Holy Angels provides a continuum of services for individuals with intellectual and developmental disabilities from birth through older adult. They also provide day program services. And in particular, they support infants and young children who have incredible complex medical needs. So it was a wonderful visit. It was a wonderful community supporting those people who are living at Holy Angels, those children who are living at Holy Angels. And so I just want to thank them for their work, making sure we have high quality services and supports for individuals with intellectual and developmental disabilities here in North Carolina. Next slide. We had a wonderful celebration on July 24th. Hopefully you attended an Americans with Disability Act anniversary celebration. It was the 35th anniversary. Talk about an uplifting day. It was a joint effort at the department. Special kudos to our EIPD division, EIPD. Employment and Inclusion for People with Disabilities. It's the new name of DVR. Most of you are familiar with DVR. Also the Division of Services for the Deaf and Hard of Hearing, Division of Services for the Blind. It was an incredible event. We were celebrating with individuals with disabilities, and they were sharing their experiences of the ADA, some of them pre and post the passage of the ADA. And it was a true wonderful celebration of the ways that individuals with disabilities are living in community as should be. So it was a great day, and hopefully you all celebrated the ADA. We will at the department will continue to work very hard. This is a departmental priority to make sure that people with disabilities of every kind, physical, mental, intellectual, developmental disability, have the fullest lives they can in the community with the resources that we've got. So great day. Next slide. Here's the QR code for Hot Topics. You'll see it again at the end. Please stay connected to Hot Topics. We've got a great listserv, but just today, community member didn't even know what Hot Topics was. I encourage you to have it because we've got lots of announcements from here, from across the department, funding announcements, and you do want to stay connected so you see what's going on. All right, now we're going to get into the meat of today. Reducing stigma and increasing treatment. And I should say, that reducing stigma does increase access to treatment. So they're not really two things. They're part of a bigger strategy, right? Stigma is one of the reasons people do not seek treatment. It's one of the reasons people don't raise their hand and say, I think I might need some help. We're going to talk about, the first thing we're going to talk about is our new Unshame North Carolina campaign. So next slide, I think I get one intro slide, and then I'm going to turn it over to our awesome speakers, if I'm not mistaken. So today we're going to talk about Unshame North Carolina, and Adam's already come on camera, and here comes Ashley, and Philip's going to come on camera. We're going to talk about our MOUD saturation plan. So again, making sure we have as much access to medications for opioid use disorder as possible across North Carolina. One of those ways is mobile OTP programs. So Anna and Billy are going to talk about those. And then I believe Sarah or Dee Dee are going to talk about making sure we have naloxone across the state. This fulfills, or all these initiatives really work towards two of our strategic priorities: increasing access to care, right? We need access to care everywhere in every way. And obviously, a big goal for us is preventing substance misuse and overdose. Remember, I said those numbers are coming down, which is extraordinary. Got to keep on going and continue to support people in recovery. So the next slide, just as a reminder, if you look in the strategic plan, these are all the things we're working on in this space to make sure that we are addressing access to evidence-based substance use care and decreasing overdose. The stars are the areas we're going to talk about today. Next slide. So Unshame North Carolina, I get to introduce it, and then I'll turn it over to the experts. So one more slide. It's just a picture of, oh, these are our goals. Brianna, you can go to the next one. We're tying everything to the strategic plan. Thank you. So here's a picture of our Unshame North Carolina launch. It was such a celebration. We do want to thank Wake County for inviting us to in their venue. And we had such an amazing crowd. You'll see Secretary Sangbye there. You'll see on the stage there with me, the First Lady of North Carolina, Anna Stein, a wonderful panel of experts. And Unshame really is, it's a campaign, and it has two goals. One is to reduce the stigma associated with substance use, period. That's the overarching goal. So we're actually trying to change hearts and minds, because I'm a therapist, you know? Hearts and minds do change behavior. They just do. So let's change hearts and minds. Let's make people comfortable giving and receiving help, or asking for help and giving help unconditionally, okay? So that's the first goal. The second is, we do know that here in North Carolina, there's a lot of people that feel uncomfortable using medication to support their opioid use issue, or encouraging their family member or friends to use it. There's a lot of discomfort, and there's a lot of misconception about medications. And we don't have the same misconceptions kind of around insulin, right? We think folks who have diabetes should take insulin. Just makes a lot of sense, right? So we would say that the same thing. A lot of people choose and use medication to support their long-term and short-term recovery, and that's phenomenal. And we want folks to have access to it and never to be ashamed if that is an important part of their recovery journey. So those kind of our two goals: just reduce stigma overall, change hearts, minds, and behaviors, and make sure that we're removing some of those barriers and we have more access to MOUD. All right. So I'm now, without further ado, on the next slide, I'm turning things over to Adam, Ashley, and Philip. I'm going to go off camera now. Over to you all.
Hi, everybody. My name is Adam Barnard. I'm the Community Substance Use Disorder Lead on the Advocacy and Empowerment team here at DMHDDSUS. And I'm really psyched to expand a little bit on the Unshame NC campaign and what we're trying to kick off here. Thank you, Kelly, for such an excellent introduction to the goals of the campaign and what we're really trying to do in conversation with the community, and what we hope the outcomes of this campaign are. And that's really that folks have access and utilize the treatment options that are available to them. One of the interesting things that we get to do with this campaign is really hear from our community and hear from people who have experienced or are on their recovery journey throughout North Carolina. So today I have an excellent colleague with me who I've gotten to sit through her own expert workshops on stigma and how that impacts people in the field. So we'll get to hear from Ashley here in a second, and then we'll get to hear from our colleague and friend, Philip Cooper, who is the Chief Change Agent over at Operation Gateway, and hear about the work that they're doing out west and about how important it is to tackle stigma. Can we hit the next slide just so I can get some of the stuff out of the way? We've already done this. These are the objectives of the campaign. This is what we're trying to pull off. We can go ahead and skip to the next slide. Sick. So this is really a digital campaign. This provides us a lot of opportunity to do some real live work and to have a really interesting broad reach with not just who sees our content, but who gets to contribute to our content. We have some opportunities for you to connect more with the campaign and share your own voice with us and participate in this to help tackle stigma and the perceptions folks have about opioid use disorder and medications available to them and treatment options that are available to them. We'll get to those slides here in a second, but right now I think we should go ahead and kick it over to my colleague, Ashley Worth.
Thanks, Adam. And so, hello, everybody. My name's Ashley Worth. I am newly in the role of lead for justice services here at DMHDDSUS. Previously, I served as the overdose prevention team lead over in the Division of Public Health. I am also a mother, previously worked in direct services. I have a master's in clinical mental health counseling from App State. And perhaps most importantly, or at least this has had the most impact and influence on my life, I'm a person with lived experience. And so, as someone who is in recovery from a really chaotic relationship with substances, I know firsthand how insidious stigma can be. I know the doors it closes, the harm it causes. And as a professional in this field, I also understand how stigma creates barriers on basically every level. It keeps those who need care from asking for it. It prevents those who can help from helping, or even helping in the best way possible. And so if we can lessen that stigma, we really can increase access to the services needed to save lives. And I think that's the ultimate goal here. I became part of planning for this campaign in my previous role with the Division of Public Health, and on that overdose prevention team. That team has really led efforts to reduce overdose and increase access to evidence-based treatment for years now. And working across divisions in the way that we have really brings together subject matter experts and partners from all sectors and silos. And at the state level, doing that is kind of a new thing, I will say, but it's really necessary. And not only necessary to get the work done, but also to help us model to our communities how to best do this, right? Like we need to model to our communities to bring all partners and players to the table, especially those with lived and living experience.
Thank you so much, Ashley. I've been so grateful for your participation in the campaign and helping us really shape this to be something that I'm really proud that we're able to pull off here. I'm going to kick it over now to Chief Change Agent Philip Cooper to hear a little bit about some of the work that they've been able to do out west and how important it is to tackle stigma from every level.
Well, glad to be here. And, as my comrade Ashley said, lived experience is so important, but we need not forget that lived experience alone, without the pure support of the person with lived experience doing the inner healing work that they need to do, can do more harm than good. So for those of you who do hire people with lived experience, make sure that you take care of them and make sure that they're getting the healing that they need. I am a person in long-term recovery. God used my prison experience to allow me an opportunity to reinvent myself. You see, because I come from an area where you sell the drugs, you don't do them. But see, I got on the drugs. And the reason I used the drugs was to deal with the trauma that came from living in the neighborhood that I lived in. And it's a lot of people like that who go and self-medicate and they have trauma based off the area they live in, the lifestyle, the domestic violence, the adverse childhood experiences. And so for me, it was like I was a black sheep amongst black sheep because I was doing hard drugs and that was taboo. That was not acceptable by the gang. And so whenever I did go to prison, I started to recover out loud. And my first peer support experience was actually working inside the prison as what they called a peer counselor at the time with the new direction program, which is under the Hazelden umbrella. And I would talk about my story and I would talk about the drugs that I had used. And I noticed how more and more people will open up. And especially in the black community, we really trying to keep everything on the low. What go on in this house, you better not say nothing to nobody about nothing, right? But when I got to prison and I started opening up, I started to see how I was slaying stigma even then because people were starting to be willing to talk about their experience, as my sister said, chaotic relationship with substance misuse. And so here in Western North Carolina, we are heavy on sharing our stories when we do our individualized reentry plans with people before they come out of prison, getting people connected to even the mental health resources, and people's lack of trust of systems, people's lack of the willingness to share about their condition can keep them from getting some very powerful resources. My friends at EIPD, some of y'all still know them as Voc Rehab, but you do know they changed their name to Employment and Independence for People with Disabilities. They have a significant amount of resources, but you have to have the diagnosis. You have to be participating in treatment. And we've seen like people miss out on resources because they wasn't willing to see a professional. And so whenever I'm slaying stigma and I'm telling my story, I'm letting people know that it's safe. And some people call it safe space. I like to call it brave space. You dig? And also in the faith community, as a man of God who loves the Lord, I also understand that medication and Jesus can coexist. You feel me? So equipping the saints, equipping the faith communities, helping them rise up as recovery coaches, opening up their space as healing spaces, repurposing some of that real estate. But none of this happens if we don't slay stigma. And the way that I slay stigma is by sharing my story and raising up other stigma slayers. Because I'm not the only one. I'm one of them. And I'm going to continue to be loud. And others will start to see that it's brave spaces that they can come into, get the credentials they need, and go out and slay stigma right along with me.
Thank you for that, Reverend Cooper. That rule. I'm really grateful for your participation in the campaign, and I'm grateful for everyone else who will be participating in the campaign. If we hit the next slide, we're getting a couple questions in the chat that I want to go ahead and address a little bit. One of the things we're really trying to do is share this message with as many folks as possible. Like Reverend Cooper said, really, we believe that one of the key drivers to addressing stigma in our community is folks sharing their own experience. I'm somebody who's in long-term recovery, and I know that the way I've connected with folks in my life who need access to resources is by sharing my own story of accessing resources and how now I get to live a livable life because, yeah, I had resources that helped me address my chaotic use. So you can connect with us on social media. You can amplify the message here. There's a QR screen you can go to. We are going to have webinars throughout the year. This is a 12-month long campaign. And if we go to the next slide here, you can join our community coalition. So you can be a part of amplifying our message. You can be a part of shaping our message. You can make sure that we're being attentive to all the different regions in North Carolina that you believe need to be addressed. You can do that by joining the coalition, or you can share your story. If you're not seeing your story represented in our campaign, on our social media, on our website, on any of the avenues that we're using to push out this content, then you can step up and share your own story if you would like. So we'd love for this campaign to have as many different faces and stories as possible. Great. I think that kind of wraps up the campaign. And this campaign is really to help address some of the outcomes that we're going to be hearing about later on in this webinar. So I think we can go ahead and kick it off to the next portion here.
Good afternoon, everyone. So good to see you all. And Brother Coop, Ashley, Adam, thank you so much for this exciting Unshame North Carolina. Let's get this done. And we have the right people at the helm of it. So thank you for that. I'm really grateful for all of you joining us today. Today, I'll focus on ensuring that every individual understand our medication for opioid use issues and the plan that we are incorporating to address that. This is really what we're trying to do is focus on expanding the availability of all forms of FDA-approved medications for opioid use issues. Next slide, please. We can go to the next slide. So medication for opioid use is recognized as the gold standard treatment for opioid use issues. The FDA has approved 3 medications for this purpose, and many of you know which those medications are. There's methadone, buprenorphine, and naltrexone. These medications are crucial in helping individuals manage their condition and work towards recovery. In addition to these medications, counseling and various therapies, and of course, self-help, play an important role in the treatment process. Traditionally, success in medication treatment is measured by program retention, adherence to the medication, abstinence from opioid use and other drug use, and other individual-specific achievements. Our goal is not to limit or dictate the duration of medication treatment, but to support each individual's choice in determining their recovery path. This approach is vital because in 2024, 8 North Carolinians died each day from opioid poisoning. And most of this is preventable. Over 200,000 are estimated to have problematic opioid use issues. And these statistics highlight the urgent need for comprehensive and accessible treatment options. Next slide, please. Our comprehensive plan for medication-assisted treatment for opioid use issues and integration in North Carolina focuses on several key areas. Number 1, as we have been talking about this in this webinar, reducing stigma. We aim to address negative stereotypes and shift public and professional perceptions of medication-assisted treatment, specifically for opioid use issues. This will be achieved through provider outreach, policy changes, education, and centering the lived experience of those impacted most by opioid use issues. Additionally, expanding access is another key element. Our goal is to make these medications available in all 100 counties of North Carolina. This will be done through opioid treatment programs, office-based opioid practices, which includes primary care settings and community partnerships. Increasing provider capacity. We are also aiming at training, mentoring, and supporting new prescribers and clinics to ensure that more healthcare providers are equipped and comfortable to offer these life-saving medications for sustained recovery. Improving retention in treatment. By enhancing the quality and continuity of care, we aim to increase long-term engagement in treatment programs. And lastly, but most importantly, ensuring equity. We want to prioritize underserved populations, including rural residents, pregnant individuals, justice-involved individuals who are either returning to their communities or are impacted by criminal justice system, adolescents, and other minorities. Ensuring equity in access to treatment is a cornerstone of our plan. Next slide, please. Expanding access and increased capacity through primary care. NC-PAL is one of the projects that I would love to talk about today. One of the key initiatives to expand access and increase capacity is through NC Psychiatry Line, or NC-PAL. This service provides consultation and education to medical providers across the state. Starting in late 2025, we will expand the psychiatry line to focus on developing consultation processes and infrastructure related to substance use issues, diagnosis, and treatment. The services will include developing strategies to promote the identification and brief treatment for substance use issues, providing consultation to support providers who are treating folks who are struggling with substance use issues. And additionally, we will offer referral support to connect providers to existing practices that support the medications and technical assistance for programs currently in place in North Carolina. Preliminary work will involve identifying the most underserved areas of the state through prevalence and data, identifying existing prescribers who are either prescribing or need more technical assistance to provide these medications. This expansion is crucial to increasing that more individuals have access to the care they need in their own communities. Next slide, please. We're also partnering with North Carolina Community Health Center Association. This organization represents the state's federally qualified health centers, also known as community health centers. These centers provide primary health care, dental care, mental health and substance use issues care, and other supportive services at over 600 sites in 92 counties. In 2023, 31% of the individuals served by these centers were uninsured. Our partnership with them began in 2023 with the objective of increasing access to evidence-based treatment for individuals who were struggling with opioid use issues. This includes the provision of medications and clinical treatment services, peer support services, and support at other more than 25 FQHC sites. Data through March 2025 shows that over 38,000 assessments were conducted. Prescriptions for buprenorphine were written that were over 17,000, and many clinical services were provided, including peer support services. The low barrier model is proving effective. Our health centers are seeing patients who initially only wanted the medications for their opioid use issues, but are now also seeking therapy, recovery housing, care management, and more supportive services. Patients are thriving, accessing housing, gaining employment, and improving relationships with family and friends. They're even making referrals for their own family and friends to seek treatment. In conclusion, our comprehensive plan aims to reduce stigma, expand access, increase provider capacity and comfortability, improving retention and treatment, and ensure equity in medication-assisted treatment services. By working together and leveraging partnerships, we can make significant strides in addressing the opioid crisis in North Carolina. And thank you so much for being here. And I think this is my last slide. Yep. And I will pass that on to Anna and Billy.
Thank you. Thank you, Sarah. Next slide, please. So I'm Anna Stanley, the State Opioid Treatment Authority for the Division of Mental Health, Developmental Disabilities, and Substance Use Services. And I'm joined today by Billy Alexander Avery, who is the Program Director for Morse Clinic of North Raleigh. And we're going to be speaking in more detail about how we're expanding access through mobile opioid treatment programs. Next slide, please. So first, let's set the stage about what OTPs are. They're state and federally licensed facilities where comprehensive opioid treatment services are provided by a multidisciplinary treatment team. And they provide access to medication, counseling, case management, and peer support services. Our OTPs serve an important role because they are the only level of care where all FDA-approved medications, including methadone, can be provided. And they're the recommended level of care for patients that are not successful in an office-based setting, or for patients that would benefit from methadone over buprenorphine, or for patients who need to switch between the two medications. Next slide, please. So after only 3 months in treatment, our OTP patients report improvement in mental health symptoms, employment, relationships, among the other outcomes that are listed here. Next slide, please. You can find all of our licensed OTPs on the central registry map that's linked here. And the footprint of our OTPs is growing quickly. We're actually up to 96 OTPs across 55 counties as of this morning. Our patients reside in all 100 counties, and in 2024, we served over 31,000 patients. Next slide, please. So we know OTPs are an effective treatment model, but in interviews asking our patients about their barriers to entering or remaining in treatment, aside from active substance use symptoms, the most common barrier is lack of transportation. Mobile units bring OTPs to areas that would otherwise be underserved. And I'm now going to turn the floor over to Billy to speak more about the first mobile unit on the road in North Carolina. Next slide, please.
Thank you, Anna. I'm Billy Alexander Avery, and I'm the Program Director at Morse Clinic of North Raleigh. And we have been blessed in the last month to have launched the first mobile unit, OTP unit in the state of North Carolina, in partnership with Mission Mobile and Healing Transitions. We are currently in our 5th week of serving over 53 clients in that first month of treatment. We've admitted over 53 clients. We currently have 49 active clients on the mobile unit. So what I wanted to talk to you about today is kind of what we did and how we've done it and where we're going with it. One of the things that was mentioned earlier was that stigma is present. And what I have found is that stigma is also present in treatment programs. And one of the key areas of reducing stigma is basically treating people with dignity and respect when they come for treatment. And we have, as a mobile unit, we had originally decided that we were going to do two sites, but the second site didn't work well for us at this point. So we put it on hold. And at this point, we have one site, which is located at the men's campus of Healing Transitions. And Healing Transitions is a program that provides multiple services, including residential, detox, shelter, and peer support services, but does not provide MOUD services, does not provide medications for individuals with opiate use disorders. So that's where the mobile unit comes in, is that mobile unit goes daily, 5 days a week, to Healing Transitions, which is where their clients from Healing Transitions, as well as community members, can access services in their own community. The goal for us was to launch a fully functioning OTP on wheels. We wanted to be able to do screening, intake, medical appointments, drug screens, counseling, and dosing, medication. We wanted to be able to do that all on the mobile. And we've been fairly successful with that, with the fact that we now can implement telehealth. We are able to provide all of those services on the mobile unit and have been doing that now for the last month. I wanted to talk a little bit about the mobile many people look at the mobile units as serving like the rural areas, which they certainly are very positive for, but there are also a great need in urban areas. By partnering with a treatment program like Healing Transitions, who does not provide MOUD themselves, we hope to improve on the retention rate of the clients in treatment and the time that they are on their medication. And that's one of the things that we're hoping with partnering with Healing Transitions, is that individuals will stay longer in Healing Transitions and also remain on their medication. What we do know is that the longer someone stays in treatment, the better chance they have for long-term recovery. And so our goal is to increase the time for individuals in treatment, and that's one of the metrics that we will be measuring. The mobile unit is also available for people in the community. And at this time, we have 4 community members who are receiving services on the mobile unit. The process of implementing the first mobile OTP in the state of North Carolina has involved many organizations. And I want to point out that the DEA, the Department of Health and Human Services in North Carolina, Controlled Substance and Licensing Divisions, and the Division of SODA have all been integral in making this happen. Mission Mobile, which is the organization that we've partnered with for the mobile unit, SAMHSA, and Healing Transitions are a couple more of the organizations that have been critical. Collaboration and communication have been critical in implementing the mobile unit, and it has been a journey that is just beginning. With that, I'd like to turn over to Sarah to discuss the naloxone distribution.
Thank you so much, Billy. So this presentation will outline our naloxone distribution and saturation plan, which addresses how we can scale and equitably distribute naloxone across our state and our rural communities. The focus is on improving access, aligning with strategic goals, and ultimately preventing overdose deaths. Next slide, please. Naloxone is a life-saving medication used to reverse the effects of opioid poisoning. It works by counteracting slowed breathing and central nervous system depression caused by opioids like heroin, fentanyl, and prescription medications such as oxycodone and morphine. It's available as a nasal spray or intramuscular injection, and you may hear it referred to by the brand name Narcan. It's now, thankfully, available over the counter and covered by many insurance plans. If someone you know or you is prescribed opioids, it's wise to also request naloxone prescription. Next slide, please. Naloxone nasal spray is not only effective, it's safe and easy to use. For more support, the Naloxone Saves NC website, you see the link right here, offers how-to guides, access to harm reduction supplies, and naloxone ordering portals. It also provides treatment resources, data, and frequently asked questions. This website is a central hub for agencies and individuals looking to engage in harm reduction. Next slide, please. So why is naloxone a priority? Why should we even ask that question, right? Naloxone distribution is directly tied to DMHDDSUS strategic plan, rightfully so, and under the priority of prevent substance misuse and overdose. The naloxone saturation plan supports this goal by increasing access and education, especially in communities with high overdose rates. This is especially critical for communities of color, such as American Indian, Black, and Hispanic populations, and for individuals leaving incarceration who are up to 50 times, yes, that's right, 50 times more likely to overdose within 2 weeks of release. Next slide, please. There is some good news. As Director Crosbie mentioned, fatal drug poisonings dropped in 2024 with 30,000 fewer deaths nationwide. In North Carolina, deaths decreased by an estimated over 20%, representing many less lives lost, which is still far too many. This progress is likely due to expanded naloxone access, greater access to treatment, Medicaid expansion, and opioid settlement funds, and more opioid treatment programs and harm reduction tools like fentanyl test strips. But challenges remain, and we must keep pressing forward. Next slide, please. This slide shows data from the Office of the Chief Medical Examiner. In May 2025, there were 261 suspected overdose deaths, which were down from May 2024. Year to date, we have seen slight decrease in suspected overdose deaths compared to previous year. While the data is provisional, the trend is promising. It reflects the impact of our public health response, but also underscores the need to stay vigilant and focused and improve saturation in underserved areas. Next slide, please. Our distribution strategy relies on a wide array of community-based partners and strong collaboration with our stakeholders, such as syringe services programs, local health departments, EMS with leave behind programs, reentry programs and detention centers, organizations serving people experiencing homelessness, and those working with historically marginalized population, particularly Black and American Indian adults. These partners are essential for saturating high-risk areas effectively and equitably. Next slide, please. Between 2019 and 2024, North Carolina distributed over 1 million naloxone doses, both intramuscular and nasal, through a total investments of $24 million. An additional $6 million is planned for 2025. And our funding sources include State Opioid Response Grant and Substance Use Prevention, Treatment, and Recovery Services Block Grant. This investment reflects our commitment that now we must ensure that investments leads to real-world saturation and impact, and our teams are hard at work in collaborating with our stakeholders and really getting this life-saving intervention out. And I think this is my last slide, and I will pass back to Director Crosbie.
Thank you so much, Sarah. I'm actually going to turn things over to Dina in just 1 minute, but I really want to thank all of our presenters today. Especially, again, thanks to all of our team, but especially to Philip and also to Billy for joining us today. And thank you for your partnership and the amazing things that you do in your community every single day. So we got some questions. We were able to answer some, and we'll answer some after the fact. But right now, I'm going to turn things over to Dina to take us home. But I want to thank you all for joining us today. Take care.
Thank you, Kelly. If we did not get an opportunity to answer your question entered in the Q&A pane, questions and feedback are welcome at bhidd.helpcenter@dhhs.nc.gov. The recording and presentation slides for today's event will be posted on our Community Engagement and Training webpage. The links are included in the chat box. There will be a brief survey following today's webinar, and we would appreciate your time completing it. Our next side-by-side webinar is scheduled for Monday, September 8th from 2 to 3 p.m. Our topic will be promoting suicide prevention and substance use recovery. We hope you will join us. This concludes our webinar for today. Thank you for attending.